Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at #PaymentMatters and follow me at Jeff B. Lin. My guest for today's episode is Ed Marx. Before becoming a full-time healthcare IT consultant and advisor, Ed served as a CIO of the Cleveland Clinic and the advisory board company. He was the 2019 book, Voices of Innovation, Fulfilling the Promise of IT in Healthcare, was the #1 bestseller in healthcare IT. So really exciting. Edward is currently writing a book on healthcare digital transformation that's going to get launched in Q2 of next year. Welcome, Edward. Once again, thanks for joining us today. Maybe just give a brief background on your experience in healthcare IT. That'd be helpful for our listeners.
Awesome. Well, thanks, Jeff, for having me on Payment Matters. I feel very privileged and honored to be your guest today. I've been serving in healthcare for quite some time. I started off as a janitor when I was 16 years old in a healthcare environment. And even though I was listening to Black Sabbath or something on a Sony Walkman, I just knew that I had a call to healthcare. And over the years, I just kept getting drawn back to it. So I served in many different vocations along the way within inside healthcare, from being a combat medic in the Army to being an anesthesia technologist and eventually working my way into the IT space. And so I've been a CIO of some large health systems over the last 20 years or so, leading me to where I am today. So I'm just thrilled to be a part of healthcare and the calling that we all have in helping others achieve optimal health.
Sounds like you've had a pretty broad career in healthcare, from a janitor all the way through CIO of the largest health systems and organizations out there. You've seen, I'll call it the digital transformation occurring since you started in healthcare. What do you think's been the biggest digital transformation over the last 10, 20, 30 years?
So as much as I'd rather talk about some really cool, nifty things that are happening today and in the future, if you take a look back, even over the last 10 years, it's really the digitization of the electronic health record into electronic format. So even at the beginning of the decade, before a high-tech act and things like that, there's only like 5-10% of physician practices were digitized and maybe 25% of healthcare organizations. So it's really in the last decade that everyone's become digitized. And that's so you need that as a basis for doing some of the more fun things to talk about. So when I look back, I think, that's probably the single biggest thing that's happened is the digitization of electronic health record. I think the other things that are also tangential that help make it what it is today and important now and going to the future is really the whole mobile movement, right? Everyone now has a smartphone, and so everyone can be mobile with their healthcare and doing virtual visits and things like that. So I think mobility also came about in the last 10 years, about 10 years ago, maybe 15 years ago, and really helped shape the way that healthcare is delivered today and tomorrow. And then the cloud, of course, also became an easier way for us to share records and for people to become mobile. So I think those are some of the technologies that help sort of usher in this new era that we're in, this new phase of digital transformation.
On the topic of digital health records, it's great to see sort of how you see that transforming. What's the, I've heard concerns out there about adoption rates and maybe people complaining about digital health records. Have you seen any benefits or what's the, in terms of adoption of these technologies, how has that transformed healthcare, especially on the digital health record side? Have you seen any benefit or results of that?
Yeah, I think the benefits are pretty clear. When you look at patient safety and the quality of care. Now, granted, there's still a long, long ways to go. We know that healthcare hospitals specifically are still very dangerous places to go to, but I think because of the digitization of records, it's really been quite helpful in terms of the overall quality of healthcare and the safety of it. So, as a practitioner inside of some of the most prestigious organizations in the world, I've seen firsthand the benefits both personally and professionally. I still worked as an anesthesia technologist, even as a CIO over the last year. and would see firsthand, sort of the positive impacts. But there's definitely a longer way to go. And on the sort of the other side, the flip side, is how has the digitization of records really impacted us as caregivers, us as employees? And, there's a lot of consternation about, hey, has it helped us at all? Has it made our practice even more difficult, more challenging, leading to longer hours? We talk about the burnout that's happening in the industry, and some of that could be related to the digitization of records. For instance, it might have taken me 2 to 3 seconds to write a prescription 10 years ago, but now it takes me 20 clicks, and it takes a lot longer. So, there's that whole to every advancement, there might be some things that we need to go back and clean up. So again, it's been very helpful in terms of quality of care and patient safety, but has it hurt us in terms of the practice of medicine and the time that it takes?
Got it. Yeah, I think your focus on caregiving is that has helped, and that's some great detailed results there. You talked about mobile and cloud, and I'll kind of bucket those together along with digital health records. But you go to these large healthcare IT conferences that are out there, and if you count up probably the number of apps that are there, probably thousands of apps that are out there.
Yeah, for sure.
Right, and everyone has an app for everything here. How do you see mobility, transforming in the next 5, 10, 20 years? Do you think this is going to be like a winner-take-all scenario where the large tech behemoths are going to be owning the space, or how do you see this playing out from a mobility, cloud, digital health record perspective?
I do think we're going to see a consolidation of vendors that are providing services. If you think about it, we're one of the only industries where there is such a multitude of players in the space, if you will. If you look at automotive, there's maybe 4 or 5 automotive companies that control 80% of the market. If you look at retail, there's probably 4 or 5 large retailers or clothing companies that have a large portion of the market. When you look at healthcare and software, whether it's healthcare providers, right? Or you can take the 4 or 5 biggest healthcare providers. You'd have I think the percentage is like 10% of the population of the United States. So in no other industry, and you can extend this to software as well, where there's not one provider that's going to provide everything, or 4 that are going to provide everything. So I think you're going to see a continued consolidation of providers and provider, things related to provision of care like software. And eventually you'll get down to some more dominant players. So today, because of the ubiquitous nature of the cloud and the ability to, everyone can develop an app, you've seen a proliferation of that. But I think it's really going to start consolidating, because it's going to come down to experience, right? What's driving all this is the user experience, or the patient experience, the caregiver experience. And if you make it difficult for the patient to interact with your health system, you may lose that patient. So now I gave you kind of a general answer, but I want to get a little bit more specific really quick here from the experience perspective. So imagine if you were trying to navigate my hospital and you went to the app store and you had 25 different apps for a hospital, and that's not unusual. So it would be very difficult for me as a patient, my experience, to navigate. Now imagine if I went to this app store and I found one app, but it had everything within it that I needed. And that's where we're headed. So I think gone will be the days where there's multiple apps for multiple things, and there's a lot of repetitiveness, and it's going to be down to just a single sort of application where everything that you need to interact with a healthcare system will be taken care of in a single app to enable your mobility and experience.
Do you view this single app or single consumer app to be done by the government, done by this particular health system, done by like a third-party vendor? Like, who is best equipped to create this single experience for the consumer?
Yeah, I think for right now, I think for the foreseeable future, it's going to be the health system, the hospital that is sort of driving this, but that's going to consolidate as well in the future. But today, it's just on a practical matter, even where I came from, you could have gone on to the App Store. So the example I was giving you is a real example, and you found 27 different ways to interact with our health system. Well, it's very confusing to the experience. And so now there's one way. It's very convenient. It makes it really easy to engage and interact, and that's what you need to make sure, you take care of the wholeness and wellness of people and populations. And so not everyone may be able to do that. So some will become very reliant on their vendors to provide some aspects of that capability. So you're going to start seeing that consolidation. So some's going to go to vendors. I don't see a government role in this. So I see some going to the vendors, some going to their individual organizations that might be big enough to, develop something like that. But eventually, I think they'll all start to come together. And I'm not prepared to sort of venture a guess on exactly how that's going to transpire. But I think in the next 3 to 5 years, what I described is definitely going to continue to happen and evolve.
So, as we've talked, and I was thinking about this, which is digital health records, as they gain momentum, it's almost like a snowball rolling down the hill. Data is coming out of the snowball, and it's growing, and then now you have the cloud, and now the data can be stored in the cloud, and now the data is accessible everywhere. We're starting to hear a lot more about AI because there's just too much data, and the use of AI in healthcare today. What have you seen? What's your opinion of AI in healthcare, and have you seen any benefits? What's some great things you've seen out there in the use of AI?
Yeah, I think we're early stages. So when we talked about, in the last 10, 20 years, what are some of the big things, and we sort of focused in on, the digitization of records. Well, that created a lot of data, and so I think we're early stages. I know some people we think we're fairly advanced, but healthcare in general is behind other industries, and in terms of analytics is no different. So while some other industries may have been doing sort of AI, machine learning for a few years now, I think we're just getting into it, and it's very exciting. So I've been blessed to be part of some organizations where we were doing had AI capabilities, and what we called it was augmented intelligence, not artificial intelligence. Because the way we see it, and the way I personally view it, is that technology is there to augment the clinician, the caregiver, in terms of delivering the care, because ultimately we are still human and we still have empathy, and empathetic care is healing care. And I don't think you want to get in a situation where you take out completely and you lose that empathy, because a machine can't love on a person the way that a real person can. And so that's why we prefer to call it augmented. So how do we augment care using data and advanced analytics? And so there's real use cases out there today. Now, it's not advanced everywhere, but that's coming. I think, if you were to ask a question, what's coming in the next decade, I would say we're going to see the fruition. We're going to see the fruit of AI and voice and some other technologies to really help digitally transform the care that we give. So to go back to the question, one example, and actually there was one that came out from Google in late December, which was pretty exciting as well, about the ability to help with radiology or augment radiologists in terms of them being able to identify breast cancer. But we were doing many things like that already, utilizing AI and becoming very prescriptive with medicine. So an example would be, in the past, if you had a particular type of tumor, you would get the same treatment as everyone else, because that's what we knew to do best. That was best practice, even though that radiation treatment was only 50% effective, but it's the best that we knew. So you would get that same treatment, and hopefully you were on the 50% side of effectiveness. Well, using AI and looking over the history of our patients and their outcomes, we were able to look at the data and then add the augmented intelligence to it, to where we were able to uniquely identify the best treatment for that particular type of tumor. And it went up to 98% in terms of its efficacy. So think about that. So in the past, it was 50-50, but now it's 98% chance that the radiation treatment you receive would be effective. And so we're seeing that in a lot of different areas of precision medicine, and even on the administrative side as well. And on the payment side, we're starting to see applications of AI. But I as much as I love payment and, we have to have the revenue cycle part, what really gets me excited is how do we save lives with this technology, or how do we improve lives or lengthen lives? And that's one example, but there's many like that out there.
Yeah, that's amazing. This personalized medicine, or I call it even personalized care, caregiving.
Right.
Right. With augmented intelligence, I think we're at the beginning stages of this. If you're just tuning in, you're listening to Payment Matters. I'm joined by Ed Marx, and we're having a fantastic discussion about the digital transformation in healthcare. All this, as medicine is becoming more caregiving is becoming more personal and even more consumer centric. Where do you see so on the care side, where do you see the digital health technology? One of the things I've heard you talk about in the past is the virtual visits to healthcare organizations. What's your opinion of that? And in terms of how that benefits patients or benefits offering care to his patients around the country.
Yeah, I'm as you know, I'm a huge proponent, a huge believer in it, and the reason is there's multiple reasons, but one is access. So, I live in a big city. I have access to all the professionals that I could ever want to meet with. But not everyone lives in a big city. And then even if you live in a big city, maybe you don't have transportation, or maybe whatever it is that you need care for makes it difficult for you to receive that care. I would see this every day as I go to work. I'd see patients who have a terrible time with movement for one reason or another, and they go to do a follow-up appointment that takes about 5 minutes, but the whole process of getting there takes 2 or 3 hours and a lot of pain, and multiple caregivers to help that person go to an appointment that could have been done virtually. And the same in the first case I was describing. In fact, one of our guest speakers, whenever I had a town hall with my IT divisions, I always had a guest speaker that was a patient. And one time the patient was virtual because that's how she received her care. And so so she was from a remote farm in upstate New York. We were in Cleveland, and we had this great virtual visit with her as she described the benefits of virtual care. So it's really about convenience and access. And I would argue that although I cannot give you any specific data points, that's probably more effective because you're not exposing yourself. You go into an office, you go to a hospital, you are exposing yourself to other people who are ill. And so when you're receiving care at home through virtual mechanism, you don't have to deal with that potential of infection, or catch even something as simple as catching someone's cold. So I think there's a lot of reasons why virtual is catching on and will become the way that we deliver care in the future.
Got it. Yeah, and clearly access is we're starting to, I've personally seen that rise across the country, even my own local neighborhoods. I can go to urgent cares 9 to 9 and bring my kids there anytime.
Yeah, think about, I've sometimes have said, we have a moral or ethical obligation to deliver care, and virtual is another way that we can reach unreached populations. So I've been part of a clinic in remote Tanzania, and the only way we were able to deliver care there was to go there in person, which was very costly. We would bring teams from my health system, and we would go there. We worked with a university medical school, and they would bring teams, and that was very costly. Everyone loved it. It was a great experience and great for that community, but it's not cost effective. It's not sustainable. So what is sustainable, though, in what we're doing with them is doing this in a virtual fashion. And so that's, again, just another natural extension. We don't think about it a lot of times in the West, but a lot of other parts of the world, they just don't have access. So yeah, that's why I'm so passionate about this particular topic and technology.
Yeah. I was at a conference recently, and someone said the scene of the crime is oftentimes when patients get their bills. and that's what's getting a lot of the top billing right now. Large bills and even the experience of paying those bills. And I heard someone else say the last impression is the lasting impression. And oftentimes that's the bill that the patient receives in the mail. Oftentimes in the mail versus a digital experience. What's your impression of sort of the digital transformation that's occurring on the kind of the revenue cycle, billing, payment side for patients out there?
Yeah, we're so far behind, as I mentioned, compared to other verticals, other industries. We're so far behind. We're very old school. This is another area that's ripe for disruption. So what I envision is a different experience, and this is some of the things that we were building. So some healthcare organizations are a little bit more advanced than others, but I think the direction that we're headed, to the extent that we can control things, right? Because of the way that our health systems are, in the United States with the government, the way things are set up and how things are billed for, that is harder to change. But from what we can change now is the experience where I'll give you a scenario, and this is what we've built, and I think this is where some of the leading healthcare organizations are going. So, everything again is mobile and voice. So you have a situation that happens that requires you to receive care, and you go on your phone because you're not sure what kind of care you need, but you felt a little tweak in your left knee, and so you interact for no cost. You're interacting on the phone, probably with a bot, but you don't know it, and you're doing a little bit of diagnosis via the bot, and it may be that's all you need, and it's free. It saves everyone a lot of time, a lot of cost. But let's just say that it's based on some of the feedback, maybe there is something wrong and you need to talk to someone. So you can then, make a decision, come in, schedule an appointment right away, or you can, hit another button and do a virtual consult, which again is going to be cheaper for you and a lot more convenient. But before you even get there, we're going to know you, right? It's the experience. We know you because we've interacted with you before. And so we know that what kind of insurance you have. And we can tell you up front, look, you want to come for a virtual visit, it's going to be, because of your insurance, it's going to be $25. If you want to come to urgent care, it's going to be $50. Hey, you really do not need to come to the emergency room. It's going to be $500 and it's going to, be a waste. So we're going to know you. We know your insurance, and we're going to help guide you and make the best decision so that you know up front what the cost is. And let's just play out this whole scenario. You do a virtual visit, whatever, and you're going to need, you have a torn left meniscus, you're going to need surgery. Well, you should know up front how much that surgery is going to cost. So we have cost transparency, and you'll know not only the cost, but the quality too. Hey, if you go with surgeon A, his or her rate of, effectiveness is 98%, and they have this type of rating. And here's what the cost is going to be. Here's what your cost is going to be. Here's what the overall cost is going to be. So there's no surprises. And by the way, yes, you can pay everything up front. You could pay it all on your phone. We'll adjudicate everything in the background using blockchain and other technologies that are more effective than we might have today. So we want to automate this whole thing, but be very transparent with costs, help you make informed decisions, because you may decide, wow, I want to go to this physical therapist. They're a little bit, or I can do my physical therapy online. It's half the cost based on my insurance. So I don't have to make that trip out there, and the effectiveness is almost as good. So we want to give information like that to empower the patient to have choices and make appropriate choices, and they know all the cost data, they know all the quality data and safety data.
Well, there's definitely a lot to see out there, and there's a lot of change in healthcare, especially on the digital transformation side. I'll say if you had a wish for healthcare, and I'll say there's one wish, and if you could snap your fingers, then it would happen. It could be anything. Is there something in particular that resonates with you in terms of what that would be?
I don't know that there's a killer app or killer technology, but I'm all about wellness and encouraging wellness. So the more we can engage with consumers before they become patients, the better, to help educate them, to look at it from a society level, social determinants of health, be very proactive. I think that's really what's needed, and technology can certainly help enable all that. So I think that's number one. And then when we need care, because there will be time that you need care, we should provide care in the most convenient and lowest cost place possible that offers equal or even better quality and safety, and that's in people's homes. So I see the whole movement, and 5G is really going to help accelerate this, but the whole movement of care at home. So, one of the statements that I've been provocative with in the past is that 50% of our outpatient visits should be virtualized now, and 25% of our inpatient days should be at home. And I think we can do that with existing technology. And then, the last piece of that, just to really get everyone to think about it, is that our surgeries can be remote and virtualized. And what I mean by that is, let's just say that you have a particular condition. You require heart surgery that requires an expert. And typically you would leave your city in Liverpool and you would travel to a destination, a Mayo Clinic, a Cleveland Clinic. But in the future, and with 5G, there's no reason why you can't enter your local hospital, and we're using robotics today anyways, and have that specialist surgeon be in Rochester and the patient in Liverpool. And so I think you're going to see more of these capabilities emerge and more care at home, and that's going to really transform healthcare as we know it today. And from the perspective of the United States and all the billing that we spoke about and payment reform, I think it's going to help push down our overall cost of care as well. So those are some sort of examples that I don't think are too far out there, and we can really make a difference in terms of keeping people well in the first example, and then in the case where people do need care, doing it in a way that's as inexpensive as possible with the same quality of care, and doing it in a place where they feel most comfortable, and that's at home.
Thank you. It's very exciting to talk to you, hearing the vision in healthcare and what it could be. And I think many of the things you just said are near-term realities. Those are the payment matters we're tackling today. Thank you to my guest, Ed Marx, for joining me today. Ed, where can our listeners go to learn more about you?
Probably the best place right now is on LinkedIn. So I have a lot of information out there on LinkedIn that I post, and my contact information. I'm just relying on my LinkedIn presence, so I'm always happy to engage with anyone, and they can certainly contact me via that mechanism.
Great. Well, thank you once again, Ed, and thank you to all you listeners for listening in today. Remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen to this on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow #Payment Matters or connect with me on Twitter at Jeff B. Lin. You can learn more about my show at healthcarenowradio.com or at instamed.com. Until next time, I'm Jeff Lin.